The topic of today's session is digital transformation. I hope by now you've had the chance to have a look at the film with Natasha in to see how we have managed to care for patients after admission, or even in some cases without them needing to be admitted. It's not just COVID-19 that's caused us to think about what digital technology can do for us. It's something we've been interested in for quite a long time. And of course, we have a brilliant opportunity now that we are talking about new buildings to embrace all the advances that digital technology can bring to us and to patient care. So just to run you through the agenda for today and what we're going to be covering. As before, you will be on mute, and there will be an opportunity to submit questions, and that will be via the chat function to me, please. I'm Louise Halfpenny, Director of Communications. And it's important to know that this session is being recorded, and also we have mentioned to you that there is a tool that we want you to use called Menti. Please don't worry if for some reason you haven't been able to get it to work this time, but thank you in advance if you have, and we'll be using that to capture some data. Now, I have Sean Gilchrist and Catherine Hammonds with us today, and they are really leading the way in getting this organisation ready for a digital transformation. So I'm going to hand over to Sean, who's going to walk you through Doris's story. Thank you, Sean.
Thank you, Louise. Good afternoon, everyone. My name is Sean Gilchrist, and I'm the Director of Digital Transformation for West Herts. I'd like to introduce Catherine.
Hi, everyone. Good afternoon. My name is Catherine Hammonds, and I'm working with Sean and David Gaunt to help the Trust develop the digital vision and strategy for how the Trust will use technology to support improvements in the care that it delivers and the experiences of patients and staff.
Thank you, Catherine. So what we're going to do is just quickly run through Doris's story. So we've been using patient stories as a way to frame the work that we're doing around our digital strategy. And so the first element of devising a strategy is to vision. So what would the future look like? And Doris has helped us come up with ideas about how we may improve her experience and other patients' experience as part of that work. So the plan is for me to very quickly talk you through Doris's story and what we've been showing others. It's just it was used as a piece, as I say, to stimulate thinking rather than this is exactly how it's going to be. But we found it very useful, and we hope that you find it useful too. So Doris is a frail and elderly lady who is living in a care home with her elderly husband. And unfortunately, Doris has a fall at the care home. And the family is alerted that she's not moving and that there is a problem. Upon arriving at Doris's home, they realize she's fallen, and that they need to do something, and so they look at the patient portal to understand what sort of treatment she's been having, and they decide then to take her to hospital, and so Doris comes to Watford General and to our emergency department. And the family are able to check her in. Apologies, there was a slight variation on this. In our sessions, we did talk about Doris coming from a care home. So when Doris arrived in A&E, she was given a wristband, which allowed her to be tracked, and staff knew exactly where Doris was and what her condition was. And the members of the Trust's bed management team were able to triage her and take the necessary observations, and those observations were displayed in the most appropriate way for staff to view and track where Doris was. when it did come to the A&E doctors seeing Doris, they discovered that Doris had a head wound, and they were able to take photographs of that head wound and share it with other specialists in the hospital. They were also able to order some tests for Doris at that point in time and track progress against those tests, so that they didn't have to go back to the computer every 5 minutes to check on progress. There are other things happening in the hospital at the time, and it was decided that actually Doris needed an urgent CT, and so we were able to use some of the real-time information in our ops center to book Doris in for a CT and to diagnose. So we were able to also use some advanced technologies for radiologists off-site to have a look at Doris's condition and make suggestions and the various referrals. It was decided to admit Doris, and because Doris was a frail patient with early dementia, she was admitted to one of our smart rooms designed specifically to accommodate patients with special requirements. So, for example, if Doris needed to use the facilities at night, the bed and the technology would sense that Doris needed to get out of bed, and so the lighting would come on. There'd be a clear line of sight to the bathroom, and so we'd be able to tell, nursing staff would be able to tell that Doris has left the bed, as a way of making sure that we created a safe environment for Doris. We also went on to talk about robotics, and while robotics may seem futuristic, it is already being used in many hospitals in the States, where some of the more basic tasks, portering and management, dispensing of drugs, etc., are handled through robots, so that the whole experience is far more efficient. Then we went on to talk about how we coordinated Doris's care with other providers. So, for example, we decided to discharge Doris, but we wanted to also make sure that the care home was aware of what had happened in hospital, and her GP was aware of what had happened in hospital. And so we used technologies like an integrated electronic patient record to share her information, appropriately share her information with the relevant people in community and her GP and her family through the patient portal. Importantly, we wanted to make sure that Doris was able to keep in touch with her friends and family. And so there are new digital technologies that allow us to create that experience where Doris doesn't feel that she's cut off from her family when in hospital. We then decide to go and discharge Doris, and that's done digitally and in multidisciplinary teams. So you can see there's some conferencing happening there. And then Doris is discharged. And when Doris gets back to her care home, she's able to provide us with some of her own diagnostics. We're able to remotely monitor and have virtual follow-ups with Doris, so she doesn't have to come back into the hospital, but we can keep track of Doris's progress out of the hospital. And there are various technologies that we could employ there. And so that was just a rapid canter through, and I must admit that David did that a lot better, and there's a lot more clinical jargon in that. But I hope that gave you a flavour for how we've been having a discussion around using digital and visioning around digital. Thank you.
Thanks, Sean. So can everyone hear me? This is Catherine. Good afternoon. Okay, so we wanted to get your views and understand your perspectives on how you feel related to the use of technology for managing your healthcare as well as the healthcare of your family members So we have about 10 questions we wanted to ask of you, and we're using a tool called Menti as a way of capturing your feedback during this session. So we ask that everyone can please use their phone or use their laptop and go to www.menti.com. Please use the code 544081. We have about 10 questions we'd like to ask of you now. So the first question is, do you or your carer currently use either a computer, a tablet, or a smartphone for shopping, banking, or health services, such as ordering repeat prescriptions? Okay. So we've got 5 people who have submitted their feedback so far. So thank you for those 5 people. It looks like the 5 people that have submitted feedback all do use a computer, tablet, or smartphone for these sorts of things in your day-to-day life, or you have a carer that uses these. Okay. All right, so we'll move on to the next question. So the next question is thinking about the future. So thinking of about 5 years down the road, would you or your carer like to use either a computer, a tablet, or a smartphone if it helped to support your healthcare? Yes, I've got a question in the group chat. So the code for these Menti questions is 544081. So you can see the code at the top of the slide here. Yes, the code is 544081. And the code will be the same for all of the questions that we're asking of you. It's 544081. So I'll pause for a minute or so. As I see, we're getting more people using Menti. We've got 9 responses that have come in so far, all indicating yes, you or your carer would like to use a computer, tablet, or smartphone in the future if it helps to support your healthcare. So leave another minute as people get familiar with Menti. Okay, so thank you for the vote so far. I'll move on to the next question. So the next question has 2 parts. So the first part is thinking about how prepared you feel. Do you feel prepared, and do you have enough information before you come into the hospital for either your outpatient appointments, surgery, or any other care? So first ask for you to indicate yes or no, you feel prepared and have enough information. And then for anyone that does not feel prepared enough or would like further information, we'll have the next question will be an opportunity to provide feedback on what support you would like. Okay, got 7, 8 votes coming in. It looks like the audience is split. About half of you, slightly more than half, feel prepared and have enough information, but 44%, almost half, would like to feel a bit more prepared and have more information before you come to the hospital. Okay, so thank you for submitting the vote on that. So next question is, if you don't feel prepared enough or you don't have enough information, please let us know what support and what further information or what else you would like to feel better prepared before you're coming into an appointment or coming in for a surgery or a procedure. It could be from the perspective of yourself, thinking about yourself as a patient, or it could be from a family perspective, if you're coming to visit someone or accompanying a family member or friend for their appointment. Please let us know what you think. And as you can see, the feedback is being shared to everyone to support our discussions and our ability to kind of understand your perspectives. So if you type in something in Menti, we'll all be able to see your views. Again, the code is 544081. Okay. So a visual of what to expect to see in the hospital. So a representation of understanding potentially a map, or potentially being able to take a tour, a video tour, really being able to know what to expect when you're physically in the hospital. Someone to help me understand the consultation. What's going to happen during your consultation? Waiting time. Who will I see? Is there some outline of what will happen? Better understanding, better preparation for follow-up appointments. Further information, explanation of what the procedure is and why you have to prepare in a certain way, such as fasting, more detailed instructions, understanding what tests that may be part of your appointments, understanding if your carer can attend, parking for blue badge holders, a map of the area, further details on the purpose of your follow-up appointments, who you will see. Okay. Thank you for this. This is really helpful in terms of us understanding what you would like to feel more supported. Okay. So the next topic that we wanted to get your perspective on is what we're calling a patient portal. So we saw in Doris's story how Doris and her family used a patient portal to help with understanding what was going on with Doris, where to take her, what information from her care record could be available to them. So Patient Portal is a secure online system that allows you to look at information from your hospital record, manage appointments, receive test results, and send and receive messages from your hospital care team. So it would be available all the time on either a computer, a tablet, or a smartphone. So it would be something that you would log into in a secure way, or you could designate someone, if you have a carer or family member that you would like to share that access with. It would provide you with that ability to see key information from your hospital record, really understand what's happening in terms of when your next follow-up appointments are, potentially be able to reschedule the appointments within a certain kind of time frame that was agreed, receive reminders to keep track of when your next visits were, and be able to receive key information like a test result if that was appropriate. Okay, so I want to get your thoughts on what you might want to use the patient portal for, because a patient portal has a lot of different capabilities and a lot of different functionality. You want to get your perspective on what you would like to use the patient portal for, as there's a range of things that would be possible. So we have two questions. The questions are the same, but the options are different. But you can select everything if you feel that you would like to use a patient portal for all of these capabilities. So the first question is, what would you find useful to do in a patient portal? You can select all of these options if you would like to do all of these different things. So the options are, you can view, book, and request to reschedule your hospital appointments. You can receive the reminders of your appointments. You can fill in forms before you come into the hospital, such as a preoperative assessment if you are getting out of surgery or procedure. You can view clinic letters and discharge summaries or notes from your appointments and hospital stays to have a summary view of sort of what's happened to you in the past and what the plan is for the future. You can view the records of any past procedures that you may have had. You can look at lab and radiology results, such as a blood test or an X-ray report. You can communicate with your clinical team to ask questions about your condition or your healthcare. Or you could check what allergies have been recorded in your record. So thank you to the 8 people who have responded. We appreciate your perspectives. It looks like you would like to use a patient portal for all of these different options with a higher vote for viewing the lab and radiology results, and as a tool to help you communicate with your clinical team to ask questions. Thank you for that. So move on to the next question, which is the same question as the previous question, but we have even more options as more examples of things that you could use a patient portal to help you with. So the first option is understanding where you are in the course of your treatment and what the next steps are. So understanding that you've got a procedure booked in, say, X date in September, and understanding that after that, you'll have a follow-up appointment and when that might be. Looking at a video tour of the hospital to help you prepare for your surgery, your visit, to really have a sense of what to expect when you arrive at the hospital. Looking at personalized educational materials that are specific to your condition, your follow-up care, what procedure you may have had. So for example, if you're coming to the hospital for a hip replacement, you could look in the patient portal to really understand what was involved in that procedure, what the follow-up, what the next steps, what the recovery would look like, potentially helping you look at videos to assist with your rehabilitation, understand what happens after you come home to prepare for yourself as well as your family or your carer. Keep track of your current or new or stopped medications. So you have that source of your medication list. View videos to help you with any recovery or physiotherapy that you may have to do. To really work out what your travel plans are with real-time travel updates to help you navigate your way to the hospital the day of your visit. Understand what services are available at the hospital and how to access them. And the last option is booking transport to your hospital appointment. So thank you for the 10 people that have submitted your votes. It looks like of the 10 people, we've got 11 now. Keep track of your medications is coming out as something that it looks like everyone would like to use the patient portal for. But all of these options seem to be useful for some of the people in the session. So thank you so much for giving us feedback on that. So I'll move to the next question. So thinking about when you're in the hospital, either as a patient yourself or as a visitor, what would you find it helpful to use your smartphone or tablet to do when you're in the hospital? So would you find it helpful to use your phone to navigate the hospital and help find your way around if you need to go to the clinic and then go to another area after your clinic appointment? To view and receive alerts on clinic waiting times to understand how long of a wait you might have. Okay. So thank you for all the votes that have come in so far. It looks like of the 12 people that have voted, 11 would like to use their smartphone or their tablet to help understand what the clinic waiting times might be. And 7 people have said that they would like to navigate the hospital and find their way around. Okay, thank you. So thank you for your feedback on that. Okay, the next topic that we wanted to get your views on, thinking through Doris's story or any personal examples that you may have had or your family members may have had, if it was appropriate, would you prefer to have the option of having an appointment with your doctor or nurse, either over a telephone call or over a video consultation? Either of these options you would like, or you wouldn't like this option. You would not like to have the option of having an appointment over a telephone or a video call. Okay, thank you for the 11 people that have voted so far. Looks like the most popular choice is having the option of either a phone call or a video consultation, if this was appropriate. So if you didn't need to have a physical examination. And there are about 4 people that have said that they would prefer the option of a video consultation as opposed to a telephone consultation. Okay, thank you for your feedback on that. Okay, another topic that we wanted to get your perspective on that Sean describes a little bit about during Doris's story is the concept of clinical monitoring when you're at home and how technology can support monitoring of your clinical condition when you're not physically present in the hospital. So I wanted to get your thoughts on if you would find it helpful if your clinical team could remotely monitor your condition using information received from a digital device, such as an electronic blood pressure monitor or glucose monitor, to reduce the amount of times that you'd have to physically come to the hospital. So this is the question: if you would find this very helpful, slightly helpful, or not at all helpful, and you would not like to participate in what we call clinical monitoring at home. So this could have a variety of applications, really. It could be if you need your blood pressure monitored, if you've got diabetes, need your glucose monitored. For people with asthma, they have smart asthma pumps. So really thinking about how a device at home might be able to collect information that you've put in and then feed that information to your clinical team, so they can have an understanding of your measurements and sort of what's happening to you when you're at home. Okay, so got 13 votes so far. Like most of the people who voted would find clinical monitoring at home with these devices that we're calling smart devices, electronic devices, very helpful. Thank you. The final question that we wanted to ask of you is, how would you like to communicate with the hospital and your clinical team? So please select all that apply. The option of receiving letters through the post, communicating electronically by secure email or through the patient portal that we talked about, or if you prefer to have telephone calls to speak with your clinical team and the hospital. Okay, so thank you for the 13 people who voted so far. It looks like there are different ways that you would like to have the options of communication. The highest option, it looks like, is secure communication electronically. And about half the people who voted would like the option of having telephone calls. The least preferred option from this group seems to be receiving paper letters through the post. So thank you for your feedback, and thank you for using Menti to provide your views on the ways in which technology can help with communicating with your care team, managing your care, really understanding what's happening to you, what's going to happen in the future, and helping improve your healthcare. So I'll give the mic back to Sean, as this is the last question of Menti that we wanted to get your perspectives on.
Thank you, Catherine, for talking us through that. And thank you, everybody, for your responses. I found some of them very interesting and really encouraging. Louise, is there something you want to pick up?
Thank you. Yes, I was just going to say, well, thank you really to Catherine, and just how interesting I found some of the results. And it's certainly given me food for thought, and some of the things that we could do, like little videos to show people some of the areas that they're going to come and visit. And for those of you who are kind of wondering how this fits into our redevelopment programme, of course, understanding the buildings and the type of service that we want to provide in the future is really important, and we just can't do that without understanding how digital technologies can sort of move us forward. And I think the fact that we're here on this call today shows how familiar we've become in the last few months with using this kind of technology. So it was very heartening to have you with us and to see how good you're all becoming at using this. And the two things really do go hand in hand. So if you think about hospital redevelopment and you think about buildings and bricks and mortar and all the debate about where the hospital is going to be, I would really ask that in the questions you kind of park that and stick with us as we think about how services will be rather than where the services will be, because we really want you to think back on Natasha's story and what you've seen of Doris's story and have that kind of new model of delivering hospital care in your mind as you ask the questions. And if you can do them via me on the chat function, that would be great. So thank you. Back to you, Sean.
Thank you, Louise. So are we ready to take questions?
Ooh. We are. We don't have any at the moment, which.
So would it be helpful for me to?
Yes, actually, sorry, I do have one, which is a common one, Sean, which we've had before, which is about people who might not be very good with technology. Now, we don't really associate that with people necessarily being older. I know sometimes when people question us, they say, what about old people not being very good with technology? We don't really hold that view, but there are other things that might stop you from being good at technology. People of all ages can have a bit of a difficulty with technology, as well as things like eyesight and arthritis. So Sean, could you explain how somebody who's not very au fait with technology or doesn't have the equipment, how they would be able to manage and how we would interact with them? Thank you.
Thank you, Louise. So it's one of the topics that we are very familiar with, and it doesn't just apply to our patients in public, but also our staff members as well. So what we're quite conscious of is that we shouldn't be building things that exclude people from certain services, and therefore we need to be very careful about how we build those services. So technology has moved on in leaps and bounds, and the buzzword in technology is user experience, and essentially that means making something intuitive and easy to use. Now, historically in the NHS, we've really struggled with that, but more and more we're starting to take our design cues from things that are happening out in the commercial world, and building our systems around those intuitive ways of doing things. Now, you may argue that one person's intuition is different from the other, but there are a general set of design principles now that people apply across technology to make sure that they're easy to use. And so keeping it as simple as possible is one of those first principles. In terms of the physical technology itself, in some cases we may end up prescribing certain apps or providing patients with certain tools that allow them to monitor themselves from home, and in which case there will be there would be some brief handover of how the technology works. But the overriding principle is to keep the technologies as simple and as intuitive as possible, so that they actually are usable for our patients and public. And it's not just a case of handing it over and expecting them to get on with it. It's also monitoring the use of those technologies. Are they responding? Are they providing the information that we need? And if not, why? And so it's a continuous circle of trying to improve how people use technology and the stuff we get from technology. I hope that answers the question.
Thank you, Sean. And Catherine, I'd like to put a question to you, please, which is about how patient portals are different to systems that people currently use to contact their GPs.
So some of the features would be similar in terms of the ability for you to contact the GPs. So you might have the ability to use this patient portal to contact your team that is at West Harts. So some of that capability would be similar. Is that something that you would find helpful if it was similar to the way that you use your patient portal to contact your GP?
I will look out for answers, Catherine, and feedback.
Could I add to that, Louise?
Sure. Yeah. Go ahead, Sean.
So a patient portal is a construct. It's a logical thing that could be made up of many different tools being brought together in one place. So the concept of a portal is it's one place to go to get information. And if we design our portals across the the health economy, at some point in time, I'm hoping that there'll be one patient portal where you can get all your information from. Unfortunately, the NHS isn't that joined up at this point in time. So there are a number of patient portals, but the aspiration is absolutely to start moving to one place where patients and public can get their information from, and that is information from all the providers. So our community, our GPs, our acute providers such as West Harts.
Okay, Sean, so your answer there just touches on a question that somebody did submit about the sharing of diagnostics. So can you describe to us how a doctor would see a hospital result and how a hospital clinician would see something that a GP had put into a patient's record?
So all of our GPs have direct access to results, so they're able to order and see results electronically at the moment. So this is GPs in West Hertfordshire. We have to be cautious about sharing results with patients directly. So there are various things that mean that the results viewed without any sort of context or without any sort of medical interpretation may lead to problems. And so again, it's something that we are certainly able to share results, but we have to work with our clinical colleagues to make sure that we share results in the most appropriate way, so as not to create distress or harm. And so it is technically possible, and there are portals out there now that share those results for patients, and it is certainly our aspiration to be able to provide our patients with more information about their results, or at least an interpretation of their results through a portal.
Thank you. I have a question here about savings in terms of bed numbers, which is definitely something we can include in a future sort of frequently asked questions, because we do know that we saved many days, we think hundreds of days during the ongoing COVID-19 outbreak, particularly during the peak of it. And we were able to care for over 1,000 patients virtually. So you can see that it's quite easy to save a vast number of bed days, and that really does help the hospital cope with those patients who have an acute need for hospital care. So we know already that it has worked. And for those of you who saw the film with Natasha in, that's a good example of how we can care for people when they are at home. I just wanted to ask another question, possibly something you can answer, Catherine, about people's results. So if they're using a device and it's they're feeding back their own results, which are being picked up automatically by the hospital, how do they know what those results mean? And is there any explanation which will say that if their blood pressure is a certain number, that there's a cause for concern?
That's a good question, definitely, because that's a good point, that it's not just the information that you're putting in, it's not just numbers, it's the interpretation of the numbers. It's the, what does this actually mean, that gives you that information and lets you know if there might be a problem, what the next step might be, or if the number is as expected or in a normal range. So the technology does have what we call intelligence or decision support. It has the ability to help with the interpretation of what that number is and what does that mean. So it has the sort of features to be smart enough to understand that normally the number for your blood pressure, the number for any of the measures that you're putting in is normally between the range of, say, 2 and 5 or whatever the numbers might be. And if it exceeds that normal range, then it might mean that there's a reason for your clinical team to think about why it's higher than it normally is. So that's definitely a part of the technology, is the ability to help with the understanding of what the numbers mean, but it does need the clinical eyes of really interpreting and understanding what the number means for you, and then what will be next if it is not within the normal range.
Thank you. Sean, sorry, you were going to add to that question.
I was going to suggest that David Gaunt, who's an ED consultant with the Trust and our Chief Clinical Information Officer, is actually on the line. So I'm wondering if we could get a comment from him if he's available. Sorry to put you on the spot, David. Let me unmute him.
That's what I was waiting for. Thanks very much, Sean.
There you go.
Hi, hi, folks. So as Sean said, I'm David Gaunt. I'm one of the emergency department consultants here. I'm also the Chief Clinical Information Officer for the Trust. The idea of people having their access to their own records, having access to their own results is always a source of lots and lots of questions and comments, and that one as to what does normal mean, what happens if it's slightly abnormal, where do I go to find out the information, has always been the question that's been asked. I still believe that even though we're not always able to give all the explanations to all of the to everybody about all the results that they're getting, I still think having the information is better than not having that information. It's like if you rang up your bank and said, how much money have I got in there? And they went, oh, it's fine, you've got some money in there. You'd probably say, yes, but exactly how much? Similarly, when your doctor says, yes, your blood results are okay, you might actually want a little bit more information. We would have to look very carefully at how we provide the right sort of information to accompany that. Frequently asked questions and so on. What's a normal blood pressure? Which blood pressure should I be worried about? And so on. And there's a lot of work we would need to be doing to support that. Although many trusts around the country are already providing blood results and X-ray results directly to the patients. And so we can learn a lot from those other trusts who are already doing it.
Thank you, David.
Thank you, David. While we've got you on the line then, I'm going to pose another question for you, if you don't mind, David. So a couple of questions have touched on this, which is who makes the decision that somebody is going to be seen virtually? And what can you say to reassure people that seeing people virtually still enables a clinician to pick up any underlying conditions. It's that slight anxiety about, will they spot something? Will they be able to really see me and understand what my issues are?
Okay, so first bit of reassurance on that is that every clinician will have the ability to decide whether somebody is going to be seen virtually or face to face. So it's always a clinical decision. It's not made by a computer or made by anyone else. It's made by a clinician who will decide that this particular scenario that we've read about in the letter, the referral letter, warrants an initial virtual consultation. Because remember, once the clinician has seen you virtually, they can then make a decision that actually we need some more information and we need to see you face to face. The second part about that is something that I was always taught when I was in medical school, which is about 80 to 90% of diagnoses are made purely on the history alone, which means talking to somebody, finding out what their symptoms are, finding out about what happened is far, far more important than any other part of the process. So speaking to somebody, listening to them, hearing about the problems that they're talking about is the most important part. And then examining them or getting investigations will often just confirm the diagnosis that the clinician has made purely by talking to them. And clearly, talking to somebody via this sort of medium, by having the video consultation, adds so much more than just being able to talk to somebody on the phone, because you've got all the non-verbal cues, all the visual cues that helps you to understand whether people have got a little bit more that they haven't quite told you yet because they're just a little bit nervous about talking about it. Are they thinking it's maybe not quite what you're asking? So having that visual does add an awful lot. And as I say, a lot of the time, examinations are not always important, and investigations will be done purely to confirm the diagnosis, not necessarily to make it afresh. So I would reassure people that it is safe and it is very effective indeed.
Thank you. I am going to come back to you, David, so hopefully you can stay on the line, but I'm just going to... Thank you. I'm just going to throw another one to Sean, which is about technology in buildings, Sean. So, as you know, and speaking to you all from an office that's had a little bit of a flood overnight, I know very well about old buildings. But Sean, can you tell us about technology in old buildings? Are we able to provide this kind of care in the setup that we've got at the moment?
So we are constrained, absolutely, and we are actually investing in our current buildings and trying to bring it up to scratch to support some of this new technology. But it's far easier to start from a clean slate and design the buildings around the care pathways and the technologies around the care pathways going into that building. And so while it is possible, and we are doing work to introduce some new technologies, it's far easier in going into a new building.
Thank you, thank you. And before coming back to David, Catherine, I just wanted to ask a question to you, if you've got any view on the number of applications that people might be using. So I think this touches on the point earlier about, is it the same as Patient Portal? Is it different? You know, how many different technologies do you think people might need to use to manage if they've got sort of complex healthcare and they're between GPs and hospitals?
That's a good question. I think it really probably depends on the individual person's perspective, as well as, because there are so many different applications out there that are, some of them are quite specific. So there might be one if someone has COPD, there might be one if someone has asthma. So some of that might be the decision of the individual in consultation with your GP and your clinical team on what applications are most relevant for you, because there's a whole range around fitness, what to eat, how much water to drink. There's so many different possibilities. What we're trying to understand from you all is really around how you want to use the patient portal, which would be tied to the West Hart's care record, and how that would help you manage all the care and activity that's going on in relation to the care that you get at West Harts, but there could definitely be other applications that you might find helpful to use if you choose to, that are separate applications if there are other things that you want that the patient portal application doesn't provide to you that might be specific to other conditions or other kind of wellness goals, or keep tracking how much you're walking or what you're eating. There's a long list.
Thank you. I think also the question might have been not just those kind of optional apps to look after your own health, but how many apps might, or different technologies might somebody need for all the sort of statutory stuff, like their appointments and all that kind of thing. Do you think we are close, bearing in mind what Sean was saying about different parts of the NHS working slightly differently, but do you think we're near a point where people can have all of that data in one place?
Oh, I see. Sorry. So that would be the ultimate hope, that there would be only one app that covered all of your activity, experiences, communication within the whole NHS. But because what Sean was explaining is that's overall the ambition is to be as integrated and as joined up as possible, but it is a long journey to get there. So there will probably be a few different apps that you might use for your NHS care.
Thank you.
And can I add to that just briefly,
oh, yes.
Louise?
Yes. But can I just throw you the other one, which is when you finish that, David, could you go on and just give us a little bit of an insight into dermatology and how that's working? Because that's something where we're embracing a lot of technology, isn't it?
Yes. Okay. My first point, just to come on to the business about apps, I think that actually what's important here isn't necessarily the application that you use, because what I'd like to see is that people can choose which application they want to use to access the data. So I'm a bit of a cyclist myself, and there are 5, 6, 20 different types of applications that you could use to measure your cycling, and they all use the same sorts of systems to do this, but I can choose the one that I like the best. And similarly, I would expect to see that the information is there for people to look at, and they can choose which app works best for them, which suits their lifestyle and their way of working, rather than having just one app and being constrained to only use that app. Don't know whether I've got... Oh, no.
Thank you, David. And yes, you've had just a question about the dermatology and how that's working.
So what information, what specifically are you asking there, Louise?
Well, it's regarding appointments. So are GPs using different technology to request that people come for appointments, and how's that working between us and the hospital, between GPs and the hospital? As far as
as far as I'm aware, we did talk with the dermatologists about using our virtual consultation, using Attend Anywhere, to be able to have virtual consultations, not face to face with the patients. There were some interesting issues around that. Most of all, that the dermatologists were actually much more interested in static images, so photographs, rather than video. So it wasn't a question of somebody pointing their camera and having a video look at a rash, for instance, but actually much more interested in having a photograph that was then sent to them. So it was interesting. The one that we thought might actually be quite key to have, the video consultation, turned out to be less important when we actually started, because what they really wanted were those static images, the photographs that could be emailed from the patient to the dermatologist. And I think that's one of those occasions where you don't really think about it until you actually get into the practicalities of it, because the dermatologists were very keen to be using Attend Anywhere, and then found it didn't suit their need in the same way as taking photographs and having them sent to them via email or any other method.
Thank you. And I understand that the the way we've been able to use consultant time in dermatology is changing quite a lot as a result of being able to look at images online. Sean, did I see you nodding there? Do you want to confirm that for us?
So absolutely. I think the dermatology service was really the first service to use the national infrastructure. So this is the electronic referral service for advice and guidance, and sending images across to our consultants for triage. They've then since looked at other systems available within the specialty, and the emphasis is on really utilizing consultant time better by creating high definition images that can be triaged, that can be reviewed by senior nursing staff and others who could provide at least an initial diagnosis and then stream the referrals on appropriately. So it is about, as David said, a high resolution static image and a workflow to allow us to channel those really just worrying images to consultants as quickly as possible.
Thank you. And can I thank David for being on the end of the line, so to speak, just when we needed him. Thank you to Catherine. Well, thank you to all of you, especially those of you who joined us on Menti. Another day, another technology to learn, it seems. So thank you very much. That data will be really useful. And we will also send you a survey just with some follow-up questions from today. And for those of you who've already been back in touch with us previously about the investment objectives and the essential criteria, we've compiled a report which tells you a little bit more about your feedback, how we're going to use it, and that's available on our website. So you should have a link to that. It'll be either in your email already or it'll be coming this afternoon. So thank you again. If you want to do it again tomorrow, you're very welcome to join us 2 days in a row. But thank you very much for your time, and please be assured that we will take all of your feedback into account, and we are very grateful for your time. Thank you very much. Bye-bye.